John, is it appropriate for me to break in here for just 1 minute?
Yeah,
I have,
absolutely.
yeah, I have some other, as the way of the world these days, have multiple calls at singular times, and I'm going to have to get on another one in a few minutes. But I did not want this occasion to go by without saying that John Cimino, in my mind, is one of the most dedicated public servants I've ever known. I know him, I know his father, I know his family. They are all dedicated to New Jersey. And I know that as we go through this process, he's already made a difference in Mercer County on getting us more vaccine into the county. And I appreciate that. But for the whole of the New Jersey Association of Counties, he's going to do a wonderful job in advocating for what we need as individual counties, but as a state altogether. So, John, congratulations to you. The Cimino family lives on in Mercer County lore, and you're one of the best we've ever. Thank you, John.
County Executive, I didn't realize you were out there in the original Zoom. I would have recognized you before. I appreciate you taking time this morning to be with us. Thank you. Look forward to working collaboratively with you and your administration as we move into the next phases here through the vaccine distribution and getting everybody back to a sense of normalcy. So thank you for your continued efforts and working with the governor and the commissioners board to make that happen. So thank you for joining us, Brian. I appreciate it.
Thanks very much, John. I'll talk to you later. Okay. I appreciate it. Bye-bye.
County Executive, good seeing you, and thank you.
Thanks very much, John. I can't tell you how much I appreciate NJAC, Association of Counties. It has provided us with so much detail in the past year, and I want to thank you and your team for really being on the front lines and giving us counties what we need to make the argument about testing, about response to COVID-19, and you're all doing a great job. I appreciate it.
Thank you, County Executive. That means a lot. I appreciate that.
John, is it possible to say a few words of congratulations to Freeholder Cimino?
Yes, of course, Assemblyman, and thank you for joining us.
Brevity is the order of the day, but the family name Cimino has long been associated with the cause of good government in New Jersey. I had a great opportunity some years ago to be elected 4 terms as a freeholder, now commissioner, and I fully appreciate the great work that NJAC does consistently throughout the year in terms of trying to solve a lot of our regional problems and some of our state problems. And all I know is that NJAC is like all state, they're in good hands with Commissioner John Cimino at its helm, and certainly my capacity as a member of the General Assembly. If I don't do it myself, I know there's another guy who might give me the stick, Skip Cimino, but you can count on me for being in your corner about any issues that are relevant to NJAC and you need sort of support on. So wish you the best, John.
Assemblyman, thank you so much for taking time to be here. Really appreciate it. And you can whip that stick as long as you want with the executive director. I mean, that every once in a while, I think he needs that.
Great, thank you. So, John, are you ready to move into our next session? I just want to be mindful of everyone's time. I know
absolutely
we have a call with the state at 12, and others have a call as well. And I appreciate we still have a really good, showing for people on this. I apologize for the late notice, but we kind of thought about it after, the fact that everyone is on here. We kind of want to work through, some of the challenges that we're facing at the county level that we can, help to streamline the process secure funding, or, whatever we can come away with from this call, we're happy to take, to the administration and to the powers that be, just to kind of, let our voices to be heard. I know they've been terrific with, the calls and the meetings with the commissioners, with our health officers, but I still think it's important for us to meet, as county officials, to address our county specific issues and then present them, accordingly. So there's too many people to go through another roll call, and I don't want to waste that time. So instead of doing that, maybe what we can do is, I know there's some health officers on the call, some administrators, et cetera. If there's specific issues that you'd like us to address, we can raise it that way, and then we can open it up that way. So I'll go to our health officers first, because I know we have a number on the call. Are there any specific issues? And in presenting the issue, I think it's always helpful to present a solution as well to that issue. So you are welcome, and again, starting with the health officers, to share with us something that you think we can address collectively as county government, and any solutions that you may have. So any of our health officers want to jump in?
John, this is Dan from Ocean Can. I could maybe kick this off.
I knew I could count on you, Dan.
I guess I start us off in one. I think what's incredibly important, and one of the major impacts I think that we're feeling, and I think I can probably speak to a lot of my colleagues in the public health front, is the messaging and trying to just get on the same page with a timeline. I know it's difficult with that, but I think trying to get on some kind of a communication timeline and rolling this out as the messaging comes out, and when the announcement for 65 and over, and then people with underlying health conditions of all ages, 18 and over, hit. I mean, our website got hit with 200,000 hits. Our call volume went through the roof of 13,000 phone calls, and we just don't have the capacity to handle some of this. And we've kind of weathered the storm, and we've put things in place to be able to address some of that. And I think just trying to get on the same page. I would hope that as the coming weeks come, I think we're going to be in a position where we go from low supply, high demand to high supply, high demand of the vaccine, and being able to, I think, transition that and communicate that to the public and what that means, and trying to move that through, I think would be a great task to try to get that all on the same page, because I think at the local level, there's just some of those struggles with that. And then trying to tie in like the registration piece with the state system and what that means. My understanding is that the state VSS system is still kind of struggling with some of the implementation components of their system and what that means. And I think it's a very, very low utilization rate. Most of my colleagues and I speak to on the health side, most of us have our own homegrown system that's working, not perfect, but it's certainly meeting our need to be able to get in line and get the people vaccinated. I mean, we've surpassed, I believe our number is 15,000 now just with Ocean County Health. And I think some of those numbers are pretty consistent with some others as well. So I think it's communication, I guess, is the main thing, and trying to get on the same page and just trying to get a heads up with some of this. And what's our plan when we get 1 million doses coming into the state of New Jersey at one time? Like what's that plan for the rollout? And just so we know, like how much are going to the mega sites, how many are going to county public health or local health, and then all the other players that are out there. I mean, your hospitals and FQHCs and all your pharmacies and ShopRites and stuff like that. So I think that piece, I think, is a big player. Like, what's the rollout plan? Because some of these smaller sites with 300, 400 doses, it just, I don't know, it almost seems like a waste of time. You have to focus on the big sites that can push people through. I understand the access piece is challenging, but starting off, and I'll just throw the communication piece out there. And we need the vaccine to do that and roll that out. I think a lot of people are able to ramp up to do some really big numbers. It's just the vaccine supply, which I understand that there's limitations all the way up the chain with that.
Thank you, Dan. So, what did I do? There we go. Sorry about that. So, Dan, I know the health officers meet regularly and hear from the commissioner's office. You know, the counties, each counties are on 3 times a week now with the administration. You know, Mike and the rest of the staff are readily accessible, you know, so in communicating with them, these concerns, and I hear you, what recommendations should we make? I mean, because we could put together, you know, again, a correspondence to the governor's office saying that we want to, you know, see improved communications, but specifically we're looking for lead time in the rollout of the plan. But I guess I'm even looking a little further, like, do we have recommendations on what that should look like? And maybe we can make that, and maybe that'll be helpful as well. So it'll make our lives, you know, county lives in operating these sites easier. So maybe, you know, the communication from our end should be, this is kind of what we're looking for. We think this should be helpful in rolling out the vaccine moving forward. Does that make sense?
Yeah, I think it does make sense. And then, and it's good to change the plan going forward, but communicate that change, I think, to folks. Like I was on the, and there's messaging. I know there's a lot of different stakeholders involved with this, but I mean, example, I was on a call this morning with our director of the Ocean County Senior Services, who was on a conference call with the commissioner with some updates with this. And I think that's important. I mean, it's not meant to be as a criticism, but I think I've been on 3 conference calls in 11 months with the Commissioner of Health. And these are governmental public health folks, and all the different messaging from the communications with the hospitals, the senior services, the long-term care, like all these calls are happening, but they're happening in a vacuum a little bit. While there's a lot of consistency with them, there's also inconsistencies, and we just need to make sure that we're all on the same page, because I'm hearing things from other people that I'm not even aware of that's out there. I know it's a huge task in front of us, and communications will always come up in and after actions on any kind of an event. So it is a large, daunting task ahead of us. But that's, I think, we're the best thing, and that's how we're going to best serve all of our constituents and the residents that we're serving.
You know, and I think we kind of asked for this in the initial letters that we sent back in December, that maybe that the communication, instead of breaking off into those individual silos and county professional groups, you know, there be a regular communication, you know, with the state OEM, the Department of Health, the front office, and then all of the stakeholders at the county level. So it's not kind of broken off and you're not necessarily hearing different information.
John, I'm still on. Can I just?
Hey, what's up, Mike? Yeah, hey. How are you, man?
So first, we gave all the counties a level set, which I think was important last week. Many of the counties have been increased as our supply have been increased. Ocean's one of those counties. Now from there, yesterday, the plan is to do all vaccinator calls on vaccine. So what does that mean? It means hospitals, pharmacies, county, local, all the mayors of whatever particular county it is by county. And then in addition to that, you know, urgent care, so whoever vaccinates, whoever's registered as a vaccinator, get on the phone and get them to communicate with each other. When it comes to, and Dan, correct me if I'm wrong, when it comes to communicating directly with the commissioner, I can't really answer that, but I do know there are constant and regular local health department calls, correct?
There are, and we have staff that are on those. And I think somebody had mentioned this earlier on. A lot of them are conflicting. They're at the same time as your 12 o'clock call. So that makes it tough for me. I'd like to be on both, but I can't. I have staff delegated to the other, and I try to get to your Monday, Wednesday, and Friday. So it's just the competing priorities with all the communications, I think.
Yeah. So our calls is, you know, I've been going on since March 10th.
And they've been fantastic. I mean, we got great.
I don't think I've really changed much. I think they were at 11, now they're at 12. But listen, I think right now, many of our issues here outside, so obviously supply is the big issue with vaccine. I think everyone understands that. Secondarily to that, there are, system technological issues. I think that we're working through that, and quite frankly, the vendor is Microsoft, so you can't really get a much bigger vendor than that. So we are trying to work through those. There's a lot of reports of appointments being double booked. We've dealt, Dan, I think a week or two ago, whenever it was, inadvertently pulling down second dose appointments, trying to get those back up at Ocean, and everyone's had different issues. But trying to get this right sized and making sure the supply is consistent so you can book appointments out into the most important thing, and fostering communication between all vaccinators with the Department of Health, with the local health departments, with everyone on the call, which is exactly what you're asking for, is something that we've been rolling out. I'm trying to triage it based on what counties I think need it the most. So the first one was Mercer. There's going to be 3 more next week. There's going to be 4 more the week after, and on and on and on. So as the supply increases, we're going to be able to, be ready to operationalize that easier. So it's kind of like what you're asking for. It's not so much internal with OEM and health with the counties. We're trying to get everyone that has vaccinating ability on the phone. What we saw from Mercer yesterday, as one anecdote, I don't know, it could be the problem everywhere. I think in Ocean, it's certainly what Commissioner Little is concerned with. The hospitals were not reporting accurately or on time. And so what that does is it affects how we can troubleshoot where to put more vaccine, where people are going on the demand curve. What we heard from Mercer's locals is that, there's a pharmacy or an urgent care that has a waiting list of 3,000 people, right? Where they're only getting 300 vaccine or 600 vaccine total. Many of the municipalities, their residents are going to the municipalities in Mercer. So every county is not the same. I think that's an understatement probably of the entire call, but trying to figure out where the people that want to get vaccinated are going to, where they're expecting to go to, where the communication is going from those particular counties on where people should get vaccinated, what they're intaking is very important process and will be important to getting us across the finish line. So, I just wanted to chime in because
I appreciate your assistance. I think that the calls have been great to just connecting some dots, I think. So you're hearing one thing somewhere, and then we hear on your call, we hear on the state health call. And so it helps trying to connect those dots, and anything we can do to help connect those dots more quickly, I think it's always good, just so we're all on the same page. Because I can guarantee everybody on this call is getting flooded with calls. I mean, it's not just us, it's not just you, and anything we can do to help resolve that and provide that messaging out to the community, and maybe it's a marketing plan within the state that pushes that out. I know there's some I've seen on TV and in the radio, and maybe something along those lines could be of a bigger assistance or communication piece. So just a couple of thoughts.
Understood. Thank you.
John. Can I jump in? So what we need as health officers is we need data, because that's our world. So we should have data to proceed with what we do every day. So access to NJIS to know how many vaccines in our county, who's getting it, the demographics, that will help us target population that are not getting these vaccines. Somebody asked me yesterday, how many people in Camden City have taken the vaccine? I don't know, because I don't have that data to tell people. Who do we target? African Americans, minorities, other who do we target? We don't know, because we don't have those data. If we have it, we can now go to those communities and other communities to really ask for, or rather help with health education to enable people to take that vaccine. So
Pascal, I'm sorry, John, I don't want to keep butting into every answer, but I feel like these questions. So good to see your face. I think it's the first time we've seen each other's face, but so a couple things. One, I called every county last evening, every county, whether it's executive or administrator, let them know what the allocation for the entire county is. That's not just the county and local sites, but every vaccination site in their county. So yesterday, Pascal, last night, I called Ross on that. Now, every Monday, I will be getting an inventory list of every vaccination site in the county to show where there's inventory on vaccine. Right now, we can't differentiate between first and second doses in that allotment, or whether those sites have Moderna or Pfizer, but it will have a list and what percentage they've used. So for example, Trinitas and Elizabeth, they have 75%, but most of those 25% are second dose vaccines. So just because if someone's at 75, that doesn't mean they have 25% sitting there. So we're trying to fine tune that to try to differentiate between first and second doses. That's not happening by Monday. I could probably try to get to Moderna, Pfizer by then. With your question, so that's background. For your question in regards to, how many Camden County residents have been vaccinated? That's question one, essentially. Within that, demographically, age-wise, et cetera, maybe by municipality would be ideal. Who has gotten vaccinated so far? Is that accurate? Is that an accurate
I
understanding?
don't think that's his question, Mike. This is Dominic Vesper. The question is Camden City residents.
Okay.
We could track the Camden County residents. We're
Yeah, well, that
planning on-
kind of fits into it. Yeah. So Camden City, how many of the Camden County residents that are vaccinated, which is the first question, how many of those in Camden City are getting vaccinated? I think we could provide, and that's the
Sure.
department.
And this is part of, it's an NJIS. It's just that we don't have access to it. We have access to other state websites that we use, state systems, but we don't have access to NJIS. And that will lift up a lot of pressure from the state, because if we have that access, we know what to do. But if we don't, then we don't.
You want that access within the IIS user side system, is what you're saying?
Correct. For us to see all that, because all this, everything I'm talking about is in NJIS on a daily basis. Yeah. We
Right,
have
I think-
access to CDRSS. So that's what we're saying. We have access to CDRSS. We just need access to NJIS to know what's happening in our county.
Okay.
Yeah, I think to build on what Pascal's saying is looking at a couple things. One is how many vaccinations have been administered in Ocean County, and that could be county residents or not. We have our number. Then what Pascal's saying, I think, is how many of our residents have been, and then if you get a municipal breakdown, because that could provide us data and feedback. Say, look, we know these towns aren't coming for whatever reason. We can then target them, and also that racial breakdown, age breakdown. I think that would be a benefit to be able to plan. We may not be reaching a population that we need to reach.
Well, that's a great point.
And
Great
it's just observation in the clinic of seeing people coming in. And I can make assumptions, but it would be nice to target some of those populations.
So Mike, that would be helpful, because I'm hearing that from, all the 21 counties. If you could share the complete list with each county, I think that's what.
So that, I mean, I don't know, I don't have a timeline for that, but what I'm going to do is, and my day today, as every day, is packed till 5, but I'm going to the right people on a call. I have a 5 o'clock call with the department every night and an 8 o'clock AM call with the department every morning. I will bring that up as my first order of business. There are 2 things that are above that, inevitably, that I know of. One is obviously the second dose appointment scheduling on the NJVSS. All right, so this is all kind of tied in together, even though they're different systems. And then secondarily, making sure that counties that are part of our appointment system have the ability to prioritize by resident, which was something that was asked for. So assuming those get mitigated, or I think that, this would certainly be the next thing up.
So Mike, I think you're going to regret staying on this, staying on the video conference now. And we can certainly have a conversation, later on when you've got some time about some of the other things that we're talking about. But I do have 2 questions, if you don't mind. One from Commissioner Robinson in Somerset County, and then another from Commissioner Yardley up in Sussex County. So Commissioner Robinson, you are up first, and then when you are finished, Commissioner Yardley, for you.
Good morning. I think Daniel covered a lot of what I'm about to say, but in addition to that, I would just say when the communication comes out, or the messaging, being collaborative in what we're doing and what we're saying will be very, very helpful. Decisions are being made at the state, and we as counties and or providers are required to execute or implement. And it's kind of difficult not having that lead time, which was already said, but also being at the table to help drive some of those decisions, because we're ultimately the ones that have to respond and answer to the residents. Don't need to point fingers, don't need to throw anyone under the bus. We're all in this together. So, you may need some other voices that are within the communities, at the intergovernmental or any other agencies that need to come together to help drive that. I think that would be very, very helpful, because there are conflicting messages, as Daniel has already mentioned, as well as connecting the dots, because we're figuring this out. We've never dealt with this as a nation, as a state, even as leaders in the political realm. But again, I come from an IT background, so I have a whole nother purview or from the rock that I sit on recommendations from the IT perspective. But I've emailed you, Mike, regarding those, and to the persons that you had me reach out to. So I think for us as leaders in our own communities, there's no cookie cutting way. So I think having a voice from your county leaders would help drive some of the decisions that are coming out of the state.
So I hear you, but I don't, like, what would be an example of that?
An example would be when the decision was made to send out 95,000 emails about the appointment system, letting people know that they're eligible. There was no communication, clear communication to the residents or those of us who have to manage these questions coming in. Oh, I didn't get my email, and I know that I'm in this 1A+ group or I'm in the 1B group. So if we already have worked out the communication before things are announced publicly, if we as a collective group had messaging and kind of foresight as to what some of those FAQs will be, understanding what our own communities are expecting from us or from the state, we can combat those from the get-go. But we have to be in this together and have that communication. That was said, the expectation was, I'm going to get this email. And some of those emails didn't go out. Some people didn't receive it. So
You're talking about, I just want to be clear, you're talking about when we opened up the system for eligibility.
Yes. That's just one example.
Okay,
so
but
when things go out publicly, we need that lead time to be able to react and respond, because we're the ones that have to execute. But we need communication from the state to us before things go out publicly.
So in this particular situation, we opened up eligibility. There was 1 million people pre-registered. We communicated that not everyone was going to be open up for appointment despite them being pre-registered. Where we could have been better is a set FAQ sheet, but the FAQ sheet literally changes on a daily basis. Oftentimes, I don't even get that FAQ sheet because the advice is so technical and their explanation is so technical. For example, recently over the last week, the Gloucester County mega site has had issues that are not Gloucester County's fault. They're technical issues with the system. Okay. So I'm told Wednesday it'll be done. Then the next day I'm told Friday close of business, it'll be done. Then on Thursday, I see that the second appointments are scheduled based upon the governor's social media activity and incoming tags, etc. Then yesterday there were double booked appointments. So like, and I hear you. There's increased communication is always the ideal thing to do, but this is not like, oh, well, we're holding back information, right? So it's the information is moving so quickly that the importance of the calls that I do, which will happen, I guess, in 45 minutes on Monday, Wednesdays, and Fridays. Number one, it's important to bring what your concerns are up on the call. And when we say things like circle back or whatever, that means you email it in. Many people on those calls email it in. We mitigate it to the right people. I know who the right people are to answer the question. I just don't have all the answers to all the questions, right? Then, and also we've set up regional vaccinator calls that the counties are on north, central, south once a week that we break into those. So those questions are asked on those calls when those people are actually on the calls. Everyone knows about them. They've been happening for a month.
I understood. And it's just there are some things, it's timing. So you have the calls, but by the time you get a response or get it over or redirect to the right people, things are already out the gate. So I think sometimes we have to slow down. And when there's a misstep, then we have to be open and transparent that it's a misstep, not only to us who are in position of leadership, but the public needs to be made aware as soon as possible. Just put it out there. You're pushing information rather than people pulling information from you. But we're in this together, not pointing any fingers, just bringing it up. And I'm sure there are others who have concerns, but just follow up my email because there's some other things from a technical perspective. And I think as a project manager, somebody should be a project manager for all of this. So that's just my 2 cents.
Thank you, Commissioner Robinson. I appreciate that. And we'll have time. Mike, I know you've got to probably jump off and get ready for the 12 o'clock call, which we might want to cancel today since you're here. Anyway, so I know we have Commissioner Yardley and then Commissioner Walter, and then I think that's probably good if you don't mind, but we can continue the the
Yeah, I'll take if it's director,
Okay.
I'll stay on for the 2 and then hop off.
Yeah.
Yeah, well, it's unfortunate that Mike's leaving, but this is Commissioner Yardley. And I just want to say hello to all the health officers that remember me. I was in the field for a long time. Just a couple issues that I see. I work at this. I have a very important job. I direct traffic and talk to people as they come in. And we're having some issues where we're getting people from out of state. And I would like to have some direction when you talk to the Commissioner of Health. Is there a way that we could say New Jersey residents only? Our website is very popular. We have a real problem reaching out to our seniors who are not technologically savvy. We're trying to work that out. The other question is the governor has really complicated the issue by adding additional people into the categories. So we're getting more, it appears to me, because I don't have the data at this point, but a younger group coming in. And the question I have is, can we limit our set aside a week or say, seniors above 75 register first, and then everybody comes after? I think those are some of the issues we're facing. I know that some of the counties are saying their county only. So if you live in a certain county, you're supposed to just go to that county. We have people from all different counties coming in. So those are coming to smaller issues. I think there's also, I'm not sure, but I think that regards to a separate issue, COVID testing, I think that the counties still have to send out to all police in their jurisdiction that there are people in their jurisdiction that have are infected. And I'm wondering if that could be looked at, where we can say, you have to assume, just like they did in H1N1, just like they did, we'll go back to AIDS, that people may be affected. And that would just relieve a couple hours of work for somebody, 2-3 hours, so they could do more work on the COVID and do state reporting. And I know the vaccine continues to be an issue. There were some new regulations went into effect. I'm not going to say anything about that. I'm going to let the health department deal with that at this point. But I just think that it's, I just wanted to ask if we could look at those things, because we are really having a problem with the senior population getting into our system.
So a couple things, because you brought up a bunch of different points, but I'll just focus on the vaccine. One, county sites are allowed to prioritize folks that either live, work, or study in their counties.
Okay.
We did that for the county and local sites because you're running the sites. So if Cape May County is running the Cape May County site, right, then Cape May County residents or people that work in Cape May County that may live in Cumberland or wherever, or folks that might be going to Cape Community College, even if they may live in Delaware, they should be able to go to the Cape May County site and they should be given priority. Why do we do that? One, the counties are running the sites, or the locals are running the sites. Two, because for a lot of folks, and Commissioner Yardley, this goes kind of right into what you're saying, a lot of folks don't have access to transportation. Maybe they don't drive because of their age, maybe whatever the case may be. So if we do not allow for those priorities, then you're giving preference to folks that have the means to drive across the state, stay on the computer, to your point, Commissioner, all day, get an appointment. People don't have that time. People don't have that access oftentimes. So it's really an equity issue of why we gave prioritization to counties and locals to do that. And we faced a little bit of criticism for that from people that quite frankly don't know what they're talking about. So that is one. So yes, Greg knows this, Greg Poff. Sussex County is allowed to prioritize the 500 or 600 vaccines that you're getting a week, Sussex County residents. Now, can you focus on people 75 and over on 1 day a week? I'm sure that's something we can discuss, and I know that Greg is setting aside 100 a week so that he can call up seniors that do not have internet access so that they can get vaccinated. So I'm very well aware. I think Sussex is doing a great job. I think Sussex is also working probably the best among anyone in the state in coordination with their ShopRites and with Newton Medical Center. So listen, I know you have a very rural kind of spread out population with a couple different suburban hubs, and it creates its own set of challenges. But overall, I think Sussex is doing a good job, and I think Greg is doing the right thing by prioritizing the 100, which is about 15 to 20% of your vaccine a week, to the senior population or those without internet access.
Thank you very much.
Mm-hmm. John, you're on mute.
I was looking at your award again. County Commissioner Walter, you had your hand raised, so you are welcome to ask your question.
Yes, thanks. It kind of piggybacks off the last question. One of the problems I'm seeing, and I'm seeing this both as somebody who is registering a senior in Pennsylvania and here in Mercer County, people are registering on 20 different sites around the county. They're registering at hospitals, they're registering at private, and then taking up slots. And really kind of gumming up the system.
And then not showing.
Right. Well, because they get their first shot and now they have these, Is there any way that we could do like a public information campaign to tell people that, this, like, it's really a problem, and I see it more and more. And to be perfectly honest, the more privileged people are, the more they're doing it.
Correct.
It is really creating a problem for people that don't have the resources. And I'm seeing it in our county all the time. Just kind of throwing it out there because I think it's going to continue to build as we go on.
Do you want me to address that, or do you have more, Commissioner?
Whatever way you want to do it.
Okay. So number one, the good news is we know that's a problem. So everything you said, that everyone's aware that that is an issue, and you're 100% right in what you said, that the folks that are doing it are the folks that have more privilege, more access, more ability to get to and from wherever they want to go. So that's 100% on point. The question really is what's the solution? And some of the solutions we've talked about. So number one, in a perfect world, the NJVSS, the appointment system there, would have been up and running in November, right? But obviously with things moving the way they have been in the last 10 months, that wasn't possible. In an ideal world, once some of these bugs are fixed, I have refused to advocate for the system until the quote unquote bugs are fixed, or there's more predictability or confidence in the system. And then when that happens, and I'm confident that that will happen sooner rather than later, I will go around to some of these counties, hospitals, et cetera, and urge them to come into that site. The problem is not going to be fixed until there is one system for the entire state. Until that happens, people are going to be able to do exactly what you're talking about. So, that's pretty much the plan. I mean, every state has this issue. There is not any state in this country, unless there's some rural states in the Midwest or the far West, that has one singular state appointment system. New York has this problem. Connecticut has this problem. Massachusetts has this problem. All of our neighbors. Florida contracted with Eventbrite, and then they did a partnership with Publix. So, Texas has its own set of issues with their because of how vast it is with their registration system. Every county has a different one, but Houston, it's a whole. Everyone has done this. I'm not going to get into why, but like there was no real direction and understandably so. You guys complain maybe we need more to give more direction to counties or locals. There was no direction above us either. So that's changing. It seems to be changing recently, but that's the best kind of futuristic view or or point to the future that I can give you on that topic.
Hey, Mike. So, and actually, John Semino has one more question that he wanted to ask you, and then I promise we'll let you go. But I guess, would it be helpful for you and the administration if we came up with, and we kind of started with this, some recommendations that we thought would help roll out at the county level and kind of streamline the process? Would that benefit you and the administration in any way? Because there are folks here. I mean, you've got some fantastic health officers and OEM coordinators, administrators that have 20, 30 years of experience, have been around, have some great suggestions and ideas. And I know we communicate on a regular basis, but maybe it could be more of a bottom-up approach to kind of hearing some of the recommendations that they have.
Listen, yes, I mean, I'm always open to suggestions. Some of the questions might already be answered and you're just not aware they're answered. But yeah, if you send me one unified list from the association of recommendations,
Okay.
I'm happy to take a look at it. And also, if there are more specific questions in that list, I'll put it in front of the appropriate folks for a response.
Excellent. Thank you. Thank you, Mike. I appreciate it. And John, last question.
Yeah, thank you, John. First of all, Mike, thank you. I know the county exec came to us last night in the commissioners meeting, and the conversations that he enjoyed with the front office. We are seeing an increase next week in our vaccines. Rest assured that the commissioners board earlier this week were very aggressive in making sure that the county executive was reaching out to the governor in the front office. My question is, and first, before I do that, I don't know if I recognized my colleague, Lucy Walter, in my remarks. I didn't know if she was out there, but thank you for joining us today, Lucy, for the swearing in. Mike, my question is, and maybe you touched upon this, the anticipation of increased supply coming from the federal government at some point in the coming weeks, months. When do we anticipate that? How much do we anticipate that? And when should the counties, or those that are distributing the vaccines, be ready? I mean, with the flood of the systems of people that are registering across the spectrum, we need to be at the ready, because as you're correct, we're getting text messages, emails, phone calls, as you are, about access and where can we get it.
So here's the deal. The Biden administration this week, which is why you got an increase, by the way, increased by 30%. The issue with the predictability there is there's two different vaccines. And then if reports are correct, Johnson & Johnson, one shot will be coming online within a month, I think is probably fair to say. And essentially, I think that the Biden administration is committed to the governor and to the health commissioner and some of her team that are going to give us 3-week lookout predictability, which ironically is exactly what I did last week with all the counties by giving you guys a minimum number. So for Mercer County, Commissioner, to be clear, 800 minimum, and that's why I made clear that you can book out in perpetuity your 800 vaccine allotment that you get a week, which I'm trying to give some predictability so that you don't have to shut things down and then book appointments when you know your allocation on a Thursday or Friday, and then you got to scramble and hopefully people sign up and then you don't use your allotment so you get reduced. Like trying to say, hey, listen, you're getting 800, you make sure you do 800 vaccinations a week, you're going to keep getting 800 minimum. Now, when you give you 1,500, you're expected to use 1,500 a week. And then over time, as we keep raising, I'll realize and I'll recognize pretty quickly what your capacity is as a county. And then in Commissioner, I don't know if you're on the call with all vaccinators in Mercer yesterday, I think the critical important thing to do by county is to make sure that all vaccinators are communicating with each other to try to figure out, okay, well, if Capitol Health has 1,000 vaccines sitting on the shelf, well, there's plenty of people that are in Mercer County that want to get vaccinated. So let's have Capitol Health working with whether it's municipalities or the county or whomever to try to facilitate those partnerships. And I know for a fact it's the hospitals that are recalcitrant to that, not the elected leadership. So it's important to facilitate those conversations so everyone can understand what's going on, because everyone, and this is a natural thing, everyone wants to point fingers all the time. It is we're in the same boat. If we don't run in the same direction, we're going to sink. So we need to start start doing that. I think we've been doing that pretty much the whole time, but you know, we're in a mile 23 of a marathon right now,
Yeah.
and we got to finish. So
Appreciate it, Mike.
okay, I'll see you guys in 30 minutes. Most.
All right, I can't wait. Thanks, Mike.
Good job.
John, it's Eve Cullinan from Burlington County. Can I speak? I was trying to message you.
Oh, I'm sorry, Eve. I'm so horrible
No, no.
with this stuff. So yes, please go ahead. I'm sorry.
I know Mike left, but that is the challenge that I think many counties, including us, are facing of how the other smaller entities that are getting vaccine, that we're really unable to know what they're doing with it. You know, like the smaller FQHC is the biggest challenge. Like we have a great relationship with them, but we don't know what they're doing with the vaccine. The smaller shop rates, you know, Boyd's, the smaller, that is the challenge. So maybe they don't know, but I think it's just, I don't think it's too realistic for them to communicate with each other, but they might have a plan. But there's lots of, you know, schools that have asked if there's going to be a plan when, you know, Burlington County passed a resolution, our commissioners passed a resolution asking that teachers be included, be moved up as far as priority. So, but we've been solicited, you know, everyone wants to know how they can do their school or their private school, and that's a challenge. But I don't know the smaller people that are, the smaller groups that are getting vaccine, how they're using it. It's difficult, you know.
Right.
I was called once and I was asked to find out how they're using it, but that was, you know, Mike had asked me to call the places, and you know, that was a few weeks ago. We weren't able to find out what they were doing.
Yeah.
They should answer to the state health department.
John, the state doesn't have the time and the energy and the resources to keep an eye on every every agency giving out the vaccine. That's why if we have that access, we can now man our county and say, CVS, Rite Aid, whoever is getting the vaccine, why are you not using it for a week? So if we have that access to NJIS, we can better serve our community.
So Pascal and Eve, after we hang up, please, I mean, and I've written down what the requests were. Send me your recommendations and exactly what we need. I know Mike said he was going to work on it, but let's reduce it to writing. Whatever you need to help you to do your job moving forward in terms of getting the data or whatever other recommendations you have, please send to me, and I will get a correspondence in writing, you know, to Mike, and we'll make sure to follow up. So I'm happy to do that. So whatever you think, whatever recommendations, you know, whether it's from the health officer side, I know we have OEM coordinators on the call, our administrators, whomever it is, whatever you think that we can do to help move this along in your county, you know, we're happy to reduce to writing and advocate for that change accordingly. So the battery in my laptop is dying and I'm not near an extension cord. So if there's any other, we'll take maybe one or two comments. I'm happy to do that. If not, again, send to me your recommendations in writing.
You want off the hot seat, Donadio. You just want off the hot seat.
No, I don't. I'm good.
This is Angela, Union County. I just want to say congratulations to everyone today. This was a very robust conversation. I really appreciate the dialogue, and I continue to appreciate everyone on the call for being able to make sure that these issues become a priority. Thank you and have a good afternoon. Thank you, John.
Thank you, Angela. It's good to see you. All right, going once, going twice. Any other?
And Cannon here. I want to thank you, John, and your team and everyone on this call. What a wonderful morning. Time spent well. Thank you so much. Have a great weekend. Enjoy the snow, John.
Thank you, Ann. No snow. We don't want any snow. You'd think I have 4 boys, they would shovel the driveway for me, and it's always, they don't. It's horrible. So I'm hoping no snow. But again, thank you everyone for being on the call. I appreciate it. You know, we'll stay in touch through email, and if we need to have another, you know, meeting like this, we're happy to do it. So, John, any last words before we hang up?
No, just sincerely appreciate everyone spending time with us this morning. Thank you so much for taking the time. I wish you all well and safe and healthy this weekend. And hopefully I'm in the same boat as John, that the snow passes us.
Yes. And thank you, Angela, for doing a great job managing the IT piece of it.
Take care, everyone.
All right. Take care. Bye-bye.